Hello, classmates. My name is Susan Sanford, and I am an MHA student with Florida Atlantic University. Today, the article I would like to present to you is called Organizational Behavior Among Academic Medical School Faculty. The reason I chose this article is because my prior history as a healthcare director is in academic medicine, and I felt it was an interesting article to learn about the behaviors of the people that I work for. The first statement that stuck out to me in this article was academia is a great place to study organizational behavior, which you don't really think of physicians when you're thinking of organizational behavior. Maybe administration, staff, maybe even medical assistants, but you don't really think of physicians. But it's actually, academia is a place where competition is high, and the competitive system where rewards are based on things such as research output, the amount of money that someone's getting for grant funding, the amount of publications that a provider is putting out, what their academic rank is, and also their tenure. Later on, I'm going to talk about the disparities in gender on these actual subjects. In discussing competition a little further in an academic setting, we know that competition is a good thing. It highlights good behaviors, positive behaviors. It can bring out the best in someone and drive them to success, but it can also bring about negative tendencies and negative personality traits in someone as well. So this article serves to study certain personality traits and characteristics that go hand in hand with success, as well as those traits or characteristics that might go along with failure as well. So what types of variables do we need to consider in organizational behavior in an academic setting for faculty? First, we have fragmentation. That's working independently and not in a group or not collaborating, and that may be due to culture or environment. Responsibility are the roles and the different demands on the shoulders of these faculty. Professionalism is the mindset of how they approach their work. Burnout, the condition experienced by professionals, which can lead to depression, calling in sick. And then we have gender. Men, women, how these different roles affect genders and the disparities, which we will discuss later in this presentation. The first behavior we'll look at is fragmentation. And as I stated earlier, that are faculty or providers working independently. When you have specialties and subspecialties in academia, such as cardiology, neurology, and pediatrics, there's a lack of collaboration and departments don't mix. So we have something called silos and towers where each specialty stays within themselves. And that's influenced by the culture and environment of each academic institution. Also, in an academic situation or setting, you have hierarchy. Each department reports up, and there's a lack of collaboration between specialties and subspecialties. So what are some of the responsibilities that lie on the shoulders of faculty in an academic setting? We have them being teachers, professors for students, residents, or fellows. They may be researchers, writing books, journals, and articles. They're caregivers, giving patient care every day. Leaders, they might be a chairman of a department or a division. These affect their behaviors each day in an academic setting. Professionalism is one's mindset towards their work and involves things such as communication, clinical reasoning. It should be consistent. It should be deliberate. It should also consider the values and emotions of themselves as well as the values and emotions of others. These things are important in organizational behavior and how one is viewed. Burnout is a condition that's experienced by professionals. It can affect one's attitude. It can cause depression. It decreases work satisfaction, and it can cause professionals to call out sick, treat others poorly, treating patients poorly. It can cause sadness, a decrease in productivity, and also a decrease in the quality of one's work. We'll quickly talk about the gender disparities I mentioned earlier in the presentation. This article states that there are more men putting out publications in journals than women in academia. There are more men that are professors in an academic institution, but more women are awarded grants for different areas of medicine. And there's also an inequity in advancement. More men than women are being promoted in academia. In conclusion, all of these variables affect organizational behavior. Leadership is also responsible for organizational behavior as leaders drive the culture. So how can our leaders improve or make a positive impact in an academic setting? They can encourage diversity, they can nourish the change makers, they can create mentoring programs, and increase engagement with those physicians that are working independently in those silos and towers. And finally, appreciate our physicians, as without the physicians, we wouldn't have patients. And patient care is why we are all in healthcare. Thank you.